Senior clinical lecturer from the University of Exeter. Mr. Pankhania, thank you for joining us. And first, take us through all these process. We're hearing of Moderna, we're hearing of Pfizer now, AstraZeneca. What's the timetable? Will we see a vaccine 3 months from now, 6 months from now? Is there a conclusive answer to this question?
Almost conclusive. So the news from both Pfizer and Moderna is that they are crossing the line for FDA approval in the United States. And once they start to cross this line for the Federal Drug Administration Department's independent scrutiny, we can see it start to be deployed first in the United States and then elsewhere. And similar regulatory crossing the line for the Oxford one will happen, but we don't know exactly when, but I don't think it is far away. The important thing to share with our viewers, listeners, and everyone across the globe is this is a very good achievement. It is a good result. The Pfizer and the Moderna vaccines, and no doubt the others, are all showing one thing. We have produced a vaccine that may protect people in all age groups against SARS-CoV-2 infection. That is something really good.
How maybe groundbreaking is the fact that we're just about a year since this outbreak first came to light, first in China and then all over the world, and by now it may not happen yet, but we're quite close to having a vaccine. How fast is it when we're speaking of a medical timetable?
It's very fast, and it is remarkable, and it is good. And what makes me very happy is if you can produce a vaccine against SARS-CoV-2 at such a pace, then hopefully you will also produce a vaccine against, for example, dengue fever, malaria, better vaccine against tuberculosis, and so on, if you put your mind to it. And hopefully this will be the impetus for putting your mind to developing vaccines for other issues as well.
You mentioned other issues, and the question is this. The world at the end of 2021, when hopefully we'll have a vaccine for everybody, will be much different than the world at the end of 2019. What is the world, and what is especially the medical world, learned from these 2 years when suddenly everybody had to be isolated, walking with masks, keeping away, washing hands? What did this period meant for the medical world?
Well, the medical world has suddenly found itself underprepared, and it was underprepared because governments usually don't invest heavily in prevention. And you need to learn your lessons that prevention is cheaper. So to share with our viewers and listeners, if you invest in prevention, it will cost you, let us say, a few £billion. If you refuse to invest in prevention, you will end up spending trillions upon trillions upon trillions of dollars, pounds, shillings, whichever currency you want to say. Therefore, prevention is better. It doesn't look sexy, but you really must invest in prevention.
Clearly the most important thing, and let's hope we hear more good news in the times to come. Dr. Bharat Pankhania from the University of Exeter in the UK, thank you very much for being with us.